Good morning, everyone. I'm pleased to be here today to provide you the update on the COVID-19 vaccination effort in Pennsylvania. Despite the winter storms that affected much of the country last week and delayed nearly all shipments of COVID-19 vaccine, providers in Pennsylvania administered more than 2 million doses. In fact, through February 25th, local vaccine providers have administered 2,226,004 doses of vaccine. 86% of first doses have been administered. 49% of second doses have been administered. Yesterday alone, providers reported 79,000 vaccinations administered. So far, more than 1.5 million Pennsylvanians have received their first dose, and nearly 650,000 people have received both doses and are now fully vaccinated. We know that the actual number of people vaccinated is higher, and we're continuing to work with providers every day to make sure reporting is kept up to date. We're continuously working to improve our processes and do all that we can to get people vaccinated. We know that right now there simply is not enough vaccine for everyone who wants it. We are, however, increasing the number of ways Pennsylvanians can access our vaccine information. Yesterday, for example, we deployed a new update to the COVID Alert PA app. Pennsylvanians can now access COVID-19 vaccine resources, such as Your Turn, and the vaccine provider locations through the app. Through the app, you can also track state and county level COVID-19 vaccine metrics. Pennsylvanians who have received their first dose of the COVID-19 vaccine can also set a reminder for when it's time to receive their second dose. There's also a link to vSafe, which is the CDC's vaccine side effects tracker tool. There are more than 792,000 people who have downloaded COVID Alert PA app, and today they have easier access to our COVID-19 resources through the convenience of their smartphone. COVID Alert PA continues to be a valuable resource in our fight against COVID-19. It is still a notification exposure app, which means you can get alerts if you have a potential exposure to the virus. You can still use the daily check-in feature to track your symptoms. And you can still use the app to find the most up-to-date county case counts and hospitalizations, access information about contact tracing, and find testing locations near you. We continue to encourage all Pennsylvanians to download COVID Alert PA so we can help stop the spread of COVID-19 in our communities. We also have exciting news to share about the Your Turn tool. By the middle of next week, Your Turn will be available in several languages, including Spanish, Chinese, and German. So far, more than 180,000 people have registered their contact information in the Your Turn tool. In addition to finding out when it is your turn to get a vaccine, the Your Turn tool allows people to receive updates about vaccine distribution, and we're also looking to add more functionality to this important resource in the near future. Keep in mind that Your Turn does not schedule people for a vaccine appointment, but it allows for individuals to submit their email address to receive future updates related to vaccine opportunities when there is more vaccine available. If it is your turn, you will be directed on how to find a vaccine provider. If someone does not have internet access to use the Your Turn tool, they can call 877-PA-HEALTH to speak with a representative to determine eligibility. If eligible, the representative will help the individual find a vaccine provider near them and provide contact information to make an appointment. And there is one more update I want to share with you this morning. We are updating the COVID vaccine dashboard. When the update goes live this afternoon, it will be easier to see the number of people vaccinated separate from the number of vaccinations administered. Remember that these are two separate metrics. Because we've been administering 2-dose vaccines with several weeks between doses, the numbers can appear confusing. The other enhancement made to the dashboard is that you can now sort demographic information of people vaccinated by county. The virus remains a very real threat, and one we must take seriously by following existing mitigation orders and continuing to test. Ultimately, all protective mitigation measures, testing, and vaccinations work in conjunction to provide a safe and healthy Pennsylvania. We must have patience as the amount of vaccine available in Pennsylvania and across the country is extremely limited. While we continue to vaccinate people in phase 1A, we must keep up our efforts to stop the spread of COVID-19 by masking up, washing up, and maintaining social distancing. Thanks. We'll now open it up for questions.
Thank you. We'll take questions now. If you go ahead and use the raise your hand feature, we'll get everyone in the order that they raise their hand. So first we have Erin McCarthy from the Inquirer. Erin, you should be able to unmute now.
Hi, Lindsay. Two quick things. Thanks for taking the time today. I was curious, you mentioned in the beginning the storm not having too much of an impact on vaccinations. Do we have an estimate of how many first and second doses across the state have been affected by the second dose shortage?
So I think we are continuing to work through that process. That was a 3-week process, and of course with the storm, that did delay some of the allocation. However, I don't have specific numbers on how many have been affected. I think in total, it was somewhere close to 100,000, but I'm going to refer to our press office just to confirm that for you.
And my other question was related to county municipal health departments centralizing their distribution of the vaccine. Yesterday down here, officials in Chester County said they would really love to have more vaccine doses and that they could, in their words, cover the entire county in a better way than some of the smaller providers. What do you think of the idea of county health departments centralizing that process, getting more doses, working themselves with their biggest healthcare systems and being in charge of that process? They say that they're trained to do this and that they would be able to get vaccines out most quickly and efficiently.
So I think from the state's perspective, our goal is to vaccinate all folks in 1A. So we'll continue to work with our county partners, including those at the county and municipal health departments, to ensure that's happening. And then again, we'll continue to work through that partnership with providers as well to make sure that folks are educated and aware of what's happening on the ground. And we'll continue to work on those partnerships.
Thank you. Next, we have Jim Melwort from KYW Radio. Jim, you should be able to unmute.
I think I unmuted. It's telling me I can't, but I think it.
Yeah, we hear you.
Thanks. Initially, in the early going, the pharmacy model, the Department of Health was saying the pharmacy model in the community was really central to the plan, but recent changes like narrowing the number of providers or putting more emphasis on reporting seem as though you're targeting larger providers or counties. Where is the Department of Health's focus? Which one? And kind of piggybacking on Erin's question, what is more beneficial right now to getting this?
So I think that both are beneficial. I think our partnerships with our federal pharmacy partners has been crucial, especially to serving folks in our skilled nursing facilities and long-term care facilities. So I think that, again, those efforts are essential along with the efforts on a large scale within our counties and with our larger providers.
And is one more beneficial than the other?
I don't think so. I think, again, all of us are working together to get through our first phase of 1A. And so, again, I think we're all an important part of that work.
Next, we have Erin Martin from WPXI. Erin, you should be able to unmute.
Hi, Lindsay. Thanks for taking the time. I did have a couple of questions. This has been brought up plenty of times before, but obviously the state has at this point declined to create any sort of centralized registration system. We've seen individual providers start doing so, UPMC, individual pharmacies, but they're starting to get overwhelmed with phone calls. Their websites are crashing because of that. Why isn't the state helping more in this process?
So I think the state is helping with the implementation of the Your Turn tool. Like I said, we've had 180,000 folks sign up for that tool, and we're continuing to work with our partners, both in other agencies and within the legislative task force, to identify how we can continue to enhance this tool to make it efficient and more helpful in our efforts.
Just quickly on that note, though, I mean, of course, the Your Turn tool helps people find vaccine when it's available. I guess what is being done right now in helping when the supply isn't quite where the state wants it to be?
So I think the Your Turn tool, again, it helps folks identify where they are in the prioritization schedule. And I think in the short term, we're able to then communicate to those folks as vaccine becomes more available.
Up next, we have Deanna Durante from NBC 10, and you should be able to unmute.
I think I still I don't see you all up on my screen, so I'm not sure if you can hear me.
We can hear you.
But okay. Okay. I was still seeing somebody from another station. Question for you regarding, and I apologize, I have to step away, the Johnson & Johnson vaccine, and if that does get approval, where do you foresee that going in the state? How do you foresee it being used, considering that there has been some talk of it being less effective? It's one dose. I mean, it's a very different vaccine from what we're already using. So how do you make sure it gets into the arms of people with less concern, but also that it's not criticized as to going to communities that are more vulnerable?
That's a great one, Deanna. So we are awaiting guidance from the FDA and the CDC as this vaccine nears its emergency authorization. No allocation decisions are going to be finalized until after that emergency use authorization is granted. Once that is, or if it is granted and approved, we'll be working with the legislative task force and our partners on the ground to review determinations on allocations, hopefully early next week.
Okay, thank you.
Okay, up next, we have Tom Lehman from WGAL. Tom, you should be able to unmute.
Can you hear me, guys? Are you able to hear me?
Yes, we hear you.
Okay. All right. So what I wanted to ask, if you could talk about, since we're at the end of the week, so to speak, where do we stand as far as the second dose shortage? And is Pennsylvania able to guarantee that anybody who had to get their second dose appointment delayed is going to be able to get it within the 42-day window that they need to get it?
All second doses are secure. There was a delay, of course, because of that allocation issue and as well the weather. And so we'll be continuing to work with providers to make sure that they get those second doses. But those second doses are secure in our allocation plan. And I think if specific providers have questions, they can reach out to the department to help answer those.
Okay, up next, we have John Finnerty from CNHI. You should be able to unmute.
Yeah, can you hear me?
Yes.
Super. Yeah, thanks for doing this. I'm not sure if this is exactly in your wheelhouse or not, but the department put out guidance today related to the fact that you don't have to quarantine necessarily if you've been vaccinated. We were curious if you could talk through if there's any thought on relaxing the travel restrictions or the restrictions regarding having to get tested when you travel. Sort of where do things stand with that?
I think we're continuing to look at those mitigation orders with our partners, both at, in our epidemiology team as well as in the governor's office. So we'll continue to look at those as more vaccine becomes available and as we roll through this distribution strategy. But at this point, we're really just focused on that vaccination distribution.
But to clarify, at this point, if you travel, you do still have to get tested regardless if you've been vaccinated or not.
Yes, that is correct.
Thank you.
Thank you. Next, we have Flora Posner from PennWatch.org. You should be able to unmute.
Hi, good morning. Lindsay, we're still in phase 1A, and I know we've talked about this before, but when are we going to get to phase 1B?
I know this is a very good question, Flora, and one that does continue to come up. I don't think we're putting out estimates at this point. I think we're sticking to our goal of, summer. But again, I know that we're working through 1A. That is our focus at this time, working with our partners in the federal pharmacy partnership as well as at the county level to get through 1A and ensure that providers and citizens have what they need there.
Okay, just for clarification, you just said we're looking at summer for 1B. I thought everyone was supposed to be vaccinated by summer.
Yeah, so I think, again, we've seen delays come through just because of the weather and because of some of these allocation issues. And so, again, I think we have to be realistic and look to where we're at this time of year. I think we're still shooting for everyone by this summer, Flora, so my apologies for that confusion. But I think ultimately are working through 1A today, and that is our priority.
But is there anybody who's just, I mean, looking at this from a mathematical standpoint to say, we have this many people vaccinated, we know this many vaccines are coming in. Is somebody just even putting the numbers together to sort of come up with a timeline and an estimate to say, okay, maybe by the middle of March, based on who has been vaccinated and how many doses we're getting on a weekly basis?
Absolutely. We continue to work with our partners at the Pennsylvania Emergency Management Agency. And one thing I want to remind you of is that we are seeing more vaccines come into the Commonwealth every week. And so as that continues to occur, we'll be able to project a little bit more easily what the timing looks like.
Thank you. Up next, we have Nicole Ford from KDKA. Nicole, you should be able to unmute.
Hello. So my question is kind of on the vaccine supply. In Pittsburgh here, we're seeing a lot of mass vaccination clinics with Allegheny Health Network and now Giant Eagle. Does that mean that the vaccine supply is changing in Pennsylvania, or are they just getting more of the supply because less of it's going to the smaller pharmacies?
Yeah, so the vaccine allocation is definitely changing in Pennsylvania. I believe this week we saw 40,000 more doses allocated to Pennsylvania than last week, which was a huge jump. So we are absolutely seeing more vaccine come into the Commonwealth.
Okay, up next we have Daniel Coop from CBS 3. Daniel, you should be able to unmute.
Hey, Lindsay. I'm not sure if this is quite in your scope either, but as more people are being vaccinated, has the state updated guidance for its allowance of people at indoor or outdoor events, or are they still going with the existing mandate?
We are continuing to go with that existing mandate, Daniel. Again, those mitigation efforts are important to stop the spread. And as we work through through vaccinating some of our most vulnerable, we know it's important to maintain those mitigation efforts. However, we are continuously reviewing those to make sure that they're on track with what we have going on elsewhere.
Okay, and just for clarification, that's the 500 max for indoor and 2,500 for 10,000 plus people. Okay.
Up next, we have Cody Butler from WBRE and WYOU. You should be able to unmute.
Hi, Lindsay. Hope all is well. Branching off Phase 1B, I know a lot of teachers are in Phase 1B. I know a lot of them are starting to plan to go back, even in the next couple of weeks. And then you said by summer, hopefully. Is there any plans to get teachers vaccinated before summer?
So first, I just want to say teachers and many others play a really important role in our communities. And as a mother, I can say that firsthand. Teachers who are over 65 or have an underlying medical condition are eligible now. However, again, it's important to note how extremely low the vaccine supply has been. And so we're continuing to follow the CDC's recommendations, which has been to get the vaccine out as efficiently as possible in a way that prioritizes the most vulnerable to serious illness.
My last question, Wyoming County up in the northern tier worked with the Department of Health so they could have their own clinic, and the Department of Health approved that. I know by the time vaccines are able to go to the county to vaccinate people, but what's the importance of other counties getting on board with having clinics to help get more vaccinated? I know that's a huge thing for Department of Health to approve for county itself to vaccinate people. Tell me about how it's going to grow to where more counties, because I believe there's only 2 right now.
So we're continuing to work with the Pennsylvania Emergency Management Agency and those agencies at the county level to identify places where this can continue to happen. The department is absolutely supportive of those large clinics to, of course, be able to meet the needs of individuals in our Commonwealth's communities. But the point is we need more vaccine to be able to put those types of scalable events up.
Next, we have Michael Gorsuchner from CBS 21. You should be able to unmute.
Hi, I was wondering, kind of jumping off from travel, the idea of easing travel restrictions, business restrictions, especially when you look at restaurants. Is there any talks, or at least future talks that are going on right now, of when some of these businesses could expect some of the restrictions to ease? I mean, the case count yesterday was up about 2,300, which is relatively, low. Is there any time frame that these businesses could look forward to that?
So I don't have a time frame today. Again, we're continuously reviewing those mitigation efforts with our leadership as well as with our epidemiology team. So we'll keep you all apprised of any updates that are to come there.
And with that, I mean, is there any advice you can give to some of these businesses that are really teetering on the brink, especially restaurants that are teetering on the brink of shutting down? I mean, can you say that it could be, spring there, like early spring, there could be some changes? I mean, I think some of them are looking for any light at the end of the tunnel possible.
I definitely understand that. And as a wife of a small business owner, I definitely understand as well. But again, we're continuously reviewing, and I want to be careful to put out a timeline as to not overpromise.
Up next, we have Grace Griffin from Fox 43. You should be able to unmute.
Thank you for taking my question. So I just wanted to clarify from an earlier point that was addressed. Do people who get vaccinated fully but come into contact with someone exposed to COVID-19 have to quarantine if it's been longer than 3 months since vaccination?
I think what our epidemiology team would say is that anyone exhibiting symptoms should quarantine until they talk with their provider. I'm happy to follow up with any specifics, but I believe that's where we would land on that.
Okay, I just have one more quick question. And just because the Johnson & Johnson vaccine is something that a lot of people are talking about, and we would love to dispel any hesitation people may have if it gets approved. Can you talk about the difference in the efficacy rates and just how the vaccine would compare to the other two that are already on the market per se?
So I'm not able to talk about that again as we await the emergency authorization. And again, we await guidance from the FDA and CDC on that Johnson & Johnson vaccine. So we'll keep you apprised of any updates we have as they come down.
Up next, we have Jim Matalinsky from WTAE. Jim, you should be able to unmute.
Hi, Lindsay. Thank you for taking my question. I'd like to ask kind of a twofold question. So I'm going to ask the first part first, if that's okay. Can you kind of give me a rundown of what the specific criteria is the state uses when they decide how to allocate these doses to individual counties? What are some of the metrics, any specific metrics you can give me when deciding how to distribute them to the counties?
Sure. So I know that equity plays a big part in how we're allocating and also efficiency. I think at this point we're looking at trying to vaccinate our most vulnerable. And at this point, again, that includes population over 65. And then, of course, we're looking at the cases and death data to understand how that plays into this as well.
Thank you. The second part of that question plays off of that. We've heard specifically from officials in Westmoreland County recently. It's the 11th most populated county in the state. They have the 9th highest percentage of people over the age of 65, but yet they ran the numbers and they're seeing that they're 57th out of the 66 counties you work with when it comes to vaccine allocations, just the supplies that are being sent to them. Are you able to speak to maybe why that is the case and if there are any factors that are causing the supply to appear to be more limited to them than other counties that are similar?
I think we're taking a look at that. Again, remember that we have 66 counties that we work with, and a vaccine has been extremely limited. But we're continuing to look at that and doing an analysis on that to see what's happening there.
Okay, up next we have Sam Rowland from YDR. Sam, you should be able to unmute.
Yes, my question that I had today was I was just wondering if there's any idea or if it's being tracked at all as people keep talking about herd immunity, if there's in a sense a timeline of where in a sense we could either see Pennsylvania start exhibiting that.
So I think again and I will also follow up with any specifics our press office might have on that. But again, our focus at this point is on vaccinating the most vulnerable citizens of Pennsylvania, which are those within our 1A category.
Thanks.
Okay, up next we have Brett Schultz. Give me one moment. You are able to unmute. Okay, give us one more moment here. Okay.
Oh, sorry about that.
That's good. You should be good now, Brett.
Okay, sorry. And I was just saying thanks for taking my question. I wanted to ask about mass vaccination sites. Counties have been, promoting these mass vaccination sites, and some news organizations have certainly done stories on this as well. But my concern is that, it seems that we don't really have much promise yet of actually being able to provide vaccines for those sites. So I just want to get a comment on, what should people actually be expecting when it comes to those mass vaccination sites? Do we expect to be able to supply them with vaccine here in March, which is right around the corner?
So again, I want to be careful to overpromise. As I've said, the vaccine supply has been extremely limited. We work with our partners at the Pennsylvania Emergency Management Agency and then our county EMAs to identify where we can allocate vaccine and where it might make sense to set up those vaccine sites.
All right, thank you.
Okay, and our final question is going to be from Mike Rubicam. You should be able to unmute.
Hi, Lindsay. We have Geisinger and now Penn Medicine acknowledging they set aside vaccine for employee family members. What is the health department doing to ensure that providers are distributing vaccine fairly and not playing favorites?
This is an equity issue, so we're continuing to work with our providers on the ground to provide the guidance necessary to stick within the 1A strategy. And again, I think the order from a few weeks ago will help with that as well. And then again, continued partnership and working with our providers every single day to make sure that folks are clear on where we want them to be is really what we're focused on at this point.
And I have a quick follow-up. Does DOH consider hospital and health system board members to be healthcare personnel and thus automatically eligible under Phase 1A?
No, I do not believe we do, but I will confirm.
We do actually have time for one more question, so we will take that from Boris over at Scranton Times Tribune. So Boris, you should be able to unmute.
I'm good. So I just want to be clear. The state Department of Health is guaranteeing that nobody is going to miss a second dose, that everybody that is going to get it on time by the 42nd day.
So I think we're working as hard as we can to ensure that happens. And if providers are seeing specific issues with that, we encourage them to reach out to us so that we can work really efficiently and effectively with them on those issues.
Thank you.
All right, thank you everyone. That's all the time we have for today, and have a great weekend.